way it did, since it's voted 42 times to abolish Obamacare. That came as no surprise. But let me ask a specific question. One of the reasons that I voted for health care reform, and I'm proud that I did, was illustrated by a woman that I met in Southern Illinois. The senator has spoken today about hardworking people, including members of his own family, and I don't doubt that. This woman's name's Judy, and Judy is a housekeeper at a motel that I often go to, and we've become friends. Judy has worked the whole life in manual labor. She's been everything you can imagine: a cook, a waitress, housekeeper, all of these things. She's 62 years old. Judy told me that she had never had health insurance one day in her life, ever. She'd worked every single day she could, but she never had health insurance. It turns out that Judy was diabetic, and we found some doctors and hospitals locally in her area to give her some care. We just had an announcement in Illinois that's going to be officially released tomorrow about what this new health insurance marketplace in Illinois means for people like Judy. It means that we're going to offer 165 different health insurance plans in Illinois by 8 different insurers. The premiums at the lowest level of health insurance for those who aren't under Medicaid will be in the range of $84 a month. But the good news for Judy is that her income is so low, she now qualifies for Medicaid for the first time in her life. For the first time in her life, Judy, who would be turned down because of a pre-existing condition of diabetes, is going to have the peace of mind of health insurance. Senator, you and I are blessed to have the best health insurance in America as members of the United States Senate. So when you say you want to disband and stop Obamacare, do you want to deny the opportunity for Judy and millions more just like her for the first time in their lives to have the protection of health insurance they can afford?
Well, I thank the senator from Illinois for that question, and I will say I respect his sincerity and passion in believing that government solutions from Washington can fix this problem. I don't know if the senator from Illinois shares the views that Majority Leader Reid expressed on television, that I don't know if your objective is, as Majority Leader Reid said his was, to move to a single-payer, government-provided, socialized health care. But it may be. I don't want to put words in your mouth, certainly. I don't know one way or the other what your view would be. But I will say this. You tell the story of Judy. The best way for Judy or anyone to have health insurance is to have an economy that is booming, where people can get jobs and have opportunities. And indeed, let me respond with 2 things. Number one, before the senator from Illinois came to the floor of the Senate, I read a number of letters that have come from people all over the country. And let me just read the next one on my stack, because it happens to actually be a counterpart to your story about Judy. This was a constituent from Brackettsville, Texas, who wrote earlier this year, quote, "Since the passage of what is known as Obamacare, my insurance premiums have gone up 3 times. That doesn't count the increases in my Medicare Part A and B that have also risen. I was informed that prior to passage that certain retirees from one group would see their company support terminated after 2013, and my support will terminate after 2018. In the meantime, I've lost 2 family doctors who have left the practice and must settle for nurse practitioners and physician assistants. I am fortunate to have good coverage for which I pay dearly that is accepted everywhere. But I fear the day I can no longer afford it. I am paying for Obama's train wreck ever since the bill was passed. Surely there must be a way to defund or repeal the bill. Please help." I would note for the senator from Illinois, these pleas for help are coming from all across the country. I'm happy to yield for a question without yielding.
I think your answer to Judy is you need a better job. After working a lifetime, 62 years, hard work, the best that she can do. She's never had health insurance, and I think your answer was, Judy, get a better job. So let me ask you another question. When I voted for Obamacare, health care reform, one of the things that motivated me was the fact that health insurance companies would no longer be able to discriminate against Americans with pre-existing conditions. I've had a situation in my family of a child who had a serious physical problem, who could not have qualified but for group health insurance that was available to me as a member of Congress. If I'd have gone on the open market to buy a policy, I'm not sure I could have bought one for my family to cover my child. So when you say you want to abolish Obamacare, do you want to abolish that part of Obamacare which says you cannot discriminate against people for pre-existing conditions when it comes to health insurance if those people are victims of asthma, diabetes, cancer treatment, mental illness? Do you want to abolish Obamacare and that protection?
I thank the senator from Illinois for that question, and let me answer it in two different ways. Let me talk generally about what the senator talked about his health insurance and my health insurance as a member of the Senate, and then let me talk about pre-existing conditions separately. The first point I will make is that the senator from Illinois is passionate and has been quite eloquent describing what he perceives to be the benefits from Obamacare. And yet I think it speaks volumes that the senator from Illinois and I and every other member of Congress has been exempted by President Obama from the plain text of the statute. The statute provided, and it was inserted quite deliberately, that if we're going to impose rules on the American people, we should be subject to the same rules. We should be put in the exchanges like millions of other Americans. You just talked about the wonderful exchange. The text of Obamacare provides that you and I should be in those exchanges. And it also provides that, just like the other people in the exchange, that our employers can't subsidize it once we get in that exchange. Now, once it passed into law, the Democratic caucus met with President Obama. I obviously was not in that meeting, but I read the public reports of what occurred there. I read the press accounts, and the press accounts all indicated that the majority leader, the Democratic members of the Senate, asked President Obama, please get us out from under this. We don't want to be in the exchanges. Now, I see my friend from Illinois is shaking his head. Look, I was not in the room. You can read the press reports all say that was what occurred. But regardless, that's what happened. So that message was heard by the President because shortly thereafter the administration issued a ruling that exempted members of Congress and exempted our staff. And so I'm curious if the senator from Illinois is such a fan of the exchanges, is such a fan of the health care that has been provided to Judy. Would the senator from Illinois then support Senator Vitter's amendment to provide that every member of Congress, every one of our staffs, every political appointee in the Obama administration, and frankly, I'd like to see every federal employee all put under the exchanges so that if we're going to make the rules for the American people, that we be subject to those same rules, those same plans, so that when we go on television and say the exchanges are really, really good, we're not talking about something someone else is experiencing. We're talking about our own health care.
Without jeopardizing his control of the floor, I would like to respond and ask a question.
I'm happy to yield for a question without yielding the floor.
And the point I'd like to make is the senator is just plain wrong. What he's just stated is just plain wrong. Here is the state of the situation. The health insurance that you enjoy, and the senator from Alabama and I enjoy, as well as the senator from Virginia, is the Federal Employees Health Benefit Program. It covers 8 million federal employees and their families, including members of Congress and our staff. For the premiums that we pay for the health insurance we choose, the federal government, as our employer, pays 72% of the premiums. This is not an unusual situation. 150 million Americans, half our population, have exactly the same arrangement. Employer-sponsored, employer contributions to the health care of their employees. What the President did was to say, number one, you, Senator Cruz, myself, and others will now have to buy our health insurance through the insurance exchanges that we created in Obamacare. And with it, we will get the employer contribution as we do now, as you enjoy now personally, and I enjoy, for that purchase of health insurance. My wife and I will be choosing a policy from the health insurance marketplace in the state of Illinois. We will have 8 different insurance companies and 165 choices, and that's our insurance. What you quarrel with is the employer's contribution to health insurance. And if that is now your position, the position of Senator Vitter and the Republican Party, that it is a federal subsidy that should be stopped, You are